Hello everyone, a very warm good morning to one and all. Welcome to yet another live session from Teachers Academy. This is an exam special live session from Teachers Academy for the OET Speaking module. So we are going to have a final lab revision for this OET Speaking module, as we know that we have a coming examination on this Saturday, that is 12th of July. So first of all, I would like to welcome you all to this live session from Teachers Academy. This is Varsha here. And also for those people who are going to appear for the examination, I wish you all the very best. So it is finally time to, give your best and make out your performance. So wishing you all the very best for your examination. Let all your dreams come true this time, and also all your efforts that you have been putting, all these while, let it, make success. So as I mentioned, we are going to have a final lab revision for the OET speaking subtest. Okay, so you have been preparing this module for a pretty long time. Today we'll be recapping it all together, and if you do have any concern or any questions regarding this module or the examination format, anything, that you can just comment below. I'll be here to address the same with you. Okay, so once again, wishing you all the very best for the examination, those who are going to appear for the exam. Moving on to the discussion. As you know, OET speaking subtest is the fourth, module of the examination, OET examination. നാലാമത്തെ module ആണ്. അതുകൊണ്ട് തന്നെ, to tell you more about this module, it is the last session and also it is the shortest session, just about 20 minutes time, and it's all about presentation, the way you're performing, it's performance. So the first thing that you'll be having for the examination would be warm-up session, as you people are aware. So at first we'll be having the warm-up session, and followed by that we have to make the role play card presentation. The most important thing in warm-up session that I want you to keep in mind is you need to stay calm. So at first they'll be having a verification, followed by that they'll be proceeding with the warm-up session. ഈ warm-up sessionൽ നമുക്ക് questions എത്ര വേണമെങ്കിലും ആകാം. So ആ ഒരു ആ ക്വസ്റ്റ്യൻസ് ഡിപ്പെൻഡ് എത്ര ക്വസ്റ്റ്യൻസ് വേണമെങ്കിലും അവർക്ക് നമ്മളോട് ചോദിക്കാം. ആൻഡ് ഓരോന്നിൻ്റെയും റെസ്പോൺസസ് നിങ്ങൾ എന്ത് ചെയ്യുക, അറ്റ്ലീസ്റ്റ് 3 to 4 സെൻറ്റൻസ് എന്തെങ്കിലും ആഡ് ചെയ്തിട്ട് പറയാൻ വേണ്ടിയിട്ട് മാക്സിമം ശ്രദ്ധിക്കുക. ദാറ്റ് ഇസ് സംതിങ് വിച്ച് ഐ വുഡ് ലൈക്ക് യു ടു tell you people. And also just keep in mind, when you're giving your response, try to stay calm and speak confidently. Moreover, just maintain a pace of your speech. Don't rush, or you don't have to rush it. അപ്പോൾ നമുക്കറിയാം ഇപ്പോഴത്തെ ഒരു ട്രെൻഡ് വെച്ച് നോക്കുകയാണെങ്കിൽ കുറച്ച് അധികം നമുക്ക് ക്വസ്റ്റ്യൻസ് എക്സ്പെക്ട് ചെയ്യാം. ലൈക്ക് അവർ ആ ഒരു ഇൻ്റലക്യൂട്ട് തന്നെ ടോട്ടലി ഡിപ്പെൻഡ് ചെയ്യും എത്ര ക്വസ്റ്റ്യൻസ് ചോദിക്കും എന്നുള്ളത്. ക്വസ്റ്റ്യൻസ് യു പീപ്പിൾ ആർ pretty much familiar with, I guess. So they can ask you questions like why you choose to become a nurse, why you choose OET, which is your dream destination, the qualities of nurses and a quality that you possess as a nurse, your typical day at work, your piece of advice for the future nurses. ഇങ്ങനത്തെ questions നമുക്ക് എക്സ്പെക്ട് ചെയ്യാവുന്നതാണ്. So make sure you have answers for these questions, and also you're giving the best when it comes to the presentation also. Okay, so the first thing would be warm-up session, which would carry around 3 to 4 minutes time. സെഷൻ്റെ ടൈമിംഗ് അല്ലെങ്കിൽ വാം-അപ്പ് സെഷൻ അവർ യൂട്ടിലൈസ് ചെയ്യുന്ന ടൈം എന്ന് പറയുന്നത് 3 to 4 minutes ആയിരിക്കും. സോ ആ ഒരു കാര്യം എന്ത് ചെയ്യുക, പ്രോപ്പർലി ഓർത്തു വച്ചിരിക്കുക. ഓക്കെ, സോ ടിൻഡു ഹാസ് മെയ്ഡ് എ ക്വസ്റ്റ്യൻ. മാം, അഡ്വൈസ് കൊടുക്കുമ്പോൾ പറയാൻ പറ്റിയ കുറച്ച് പൊളൈറ്റ് ഫ്രേസസ് പറയാമോ? Okay, so at first when you're giving an advice to a person to make about certain changes ആണെന്നുണ്ടെങ്കിൽ നമുക്ക് first of all അവരോട് പറയാം, I do understand it might be difficult for you to bring about certain changes all of a sudden, but let me assure you that if you make up your mind to follow my advice, you will be getting a recovery at the earliest. Okay, ആ ഒരു കാര്യം എന്ത് ചെയ്യാം, നമുക്ക് അവിടെ മെൻഷൻ ചെയ്യാവുന്നതാണ്. ഓക്കെ, അതായത് ചേഞ്ചസ് വരുത്തുന്ന കാര്യം നമ്മൾ ആ പേഷ്യൻറ്റിനോട് മെൻഷൻ ചെയ്യാൻ പറയുമ്പോൾ, വി ഹാവ് ടു അണ്ടർസ്റ്റാൻഡ് ദി സിറ്റുവേഷൻ ഓൾസോ, റൈറ്റ്? സോ അവരോട് നമ്മൾ ഷെയർ ചെയ്യുമ്പോഴത്തേക്കൊന്നും അവരുടെ സിറ്റുവേഷനും കൂടി മനസ്സിലാക്കിയിട്ട് വേണം നമ്മൾ ആ ഒരു അഡ്വൈസ് എല്ലാം ഫോളോ ചെയ്യുന്ന കാര്യം പറയാൻ. അപ്പോൾ ഇവിടെ യൂസ് ചെയ്യാൻ പറ്റിയൊരു ഫ്രേസ് ആണ്, ഐ ഡു അണ്ടർസ്റ്റാൻഡ് ഇറ്റ് മൈറ്റ് ബി ഡിഫിക്കൽട്ട് ടു ബ്രിങ് അബൌട്ട് സർട്ടൻ ചേഞ്ചസ്, ബട്ട് ലെറ്റ് മീ അഷ്യൂർ യു, ഇഫ് യു ആർ വില്ലിംഗ്, ഇഫ് യു മേക്ക് അപ്പ് യുവർ മൈൻഡ് to change your routine, it will definitely help you to get a recovery എന്ന് മെൻഷൻ ചെയ്യാം. ഓക്കെ, അല്ലാന്നുണ്ടെന്നുണ്ടെങ്കിൽ പറയാം, I have dealt with several cases like that of yours before, so if you are willing to follow my advice, I can assure you that you will be getting a recovery at the earliest എന്ന് വേണമെങ്കിൽ പറയാം. ഓക്കെ, ഇനി അതല്ല എന്നുണ്ടെങ്കിൽ ഇപ്പോൾ പേഷ്യൻ്റ് കുറച്ചൊരു റിലക്റ്റൻസ് കാണിക്കുകയാണ് ഫോളോ ചെയ്യാൻ എന്നാണെന്നുണ്ടെങ്കിൽ നമുക്ക് അവിടെ ഒരു എംപതി സ്റ്റേറ്റ്മെൻറ്റ് ആദ്യമേ യൂസ് ചെയ്തിട്ട് നമുക്ക് എന്ത് ചെയ്യാം, ഒരു അഷുറൻസ് കൊടുക്കാം. Okay, empathy statement എന്തായിരിക്കും? See, if I were you, I would be reacting the same manner. But let me tell you that these advice, if you follow, if this advice will definitely help you to get a recovery from your current situation. അങ്ങനെയുള്ള ലൈക്ക് ഇപ്പോൾ പേഷ്യൻ്റ് ഓൾറെഡി വില്ലിംഗ് ആണ് ഫോളോ ചെയ്യാനെന്നുണ്ടെങ്കിൽ ദാറ്റ് ഇസ് പ്രിറ്റി ഗുഡ്. ഇപ്പം നമ്മൾക്ക് ആദ്യമേ തന്നെ കോൺവെർസേഷൻ ലീഡ് ചെയ്ത് വരുമ്പോൾ പേഷ്യൻ്റെ ഇമോഷണൽ സ്റ്റേറ്റ് എന്താണെന്നുള്ളത് മനസ്സിലാവുമല്ലോ. ഇപ്പോൾ അതല്ല, പേഷ്യൻ്റ് ഒരു പാർഷ്യൽ റിലക്റ്റൻസ് കാണിക്കുകയാണെന്നുണ്ടെങ്കിൽ മേക്ക് ഷുവർ ദാറ്റ് യു ആർ യൂസിങ് സർട്ടൻ എംപത്തി ഫ്രേസസ്. പിന്നെ എപ്പോഴാണെങ്കിലും അഡ്വൈസ് കൊടുത്തു കഴിഞ്ഞിട്ട് ഇറ്റ്സ് ഗുഡ് ടു എൻകറേജ് ദ പേഷ്യൻറ്റ്. അപ്പോൾ അതിൻ്റെ കൂടെ തന്നെ എന്ത് പറയാം, സി ഇഫ് യു ഫോളോ, ലെറ്റ് മീ ടെൽ യു ദാറ്റ് ഇഫ് യു ആർ വില്ലിംഗ് ടു ഫോളോ മൈ അഡ്വൈസ് യുവർ കണ്ടീഷൻ വിൽ ബി മാനേജ്ഡ്. ഇപ്പോൾ മാനേജബിൾ ആണെന്നുണ്ടെങ്കിൽ, മാനേജബിൾ കണ്ടീഷൻ ആണെന്നുണ്ടെങ്കിൽ യുവർ കണ്ടീഷൻ വിൽ ബി മാനേജ് ടു ആൻ എക്സ്റ്റെൻറ്റ്, അത് മെൻഷൻ ചെയ്യാം. അല്ലെങ്കിൽ നമുക്ക് പറയാം ഇറ്റ് ക്യാൻ ബി കംപ്ലീറ്റ്ലി ട്രീറ്റബിൾ, ഇറ്റ് ക്യാൻ ബി കംപ്ലീറ്റ്, യു വിൽ ഗെറ്റ് എ ക്യൂർ ഫ്രം ദിസ് എന്നൊക്കെ മെൻഷൻ ചെയ്യാം. ഓക്കെ, എപ്പോഴും അഡ്വൈസ് കൊടുത്തതിന് ശേഷം ഇറ്റ് വുഡ് ബി മച്ച് ബെറ്റർ ഇഫ് യു കുഡ് ആഡ് എ ഫ്രേസ് ആസ് എ ടോക്കൺ ഓഫ് എൻകറേജ്മെന്റ് ഫോർ ദ പേഷ്യൻറ്റ്, സോ ആസ് ടു അണ്ടർസ്റ്റാൻഡിങ് ദ കറന്റ് സിറ്റുവേഷൻ അറ്റ് ദ സെയിം ടൈം. I hope Tindu you got an idea. Okay, ആണെന്ന് പ്രതീക്ഷിക്കുന്നു. Then proceeding further, certain things that I want you people to remember when it comes to the utilization of your preparation time. So once your warm-up session is done, you people are pretty clear like ആ ഒരു presentation ടൈമിൽ ഏറ്റവും കൂടുതൽ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യം warm-upൽ try to add at least 3 to 4 points just like I mentioned. ഒരു 1 word അല്ലെങ്കിൽ ഒരു 1 sentence അല്ലെങ്കിൽ ഒരു 2 sentenceൽ നിർത്താതെ കുറച്ചുകൂടി ഓപ്പൺ ആയിട്ട് സംസാരിക്കാൻ ശ്രമിക്കുക. Add at least 3 to 4 sentence when they are asking question because you people are familiar with the questions, right? അതുകൊണ്ട് തന്നെ കുറച്ചും കൂടി സെൻറ്റൻസസ് ആഡ് ചെയ്തിട്ട് ആ ഒരു റെസ്പോൺസ് കുറച്ചും കൂടി കൂട്ടാൻ വേണ്ടിയിട്ട് ശ്രദ്ധിക്കുക. ആൻഡ് കമ്മിങ് ടു ദ തിങ്സ് ടു റിമെമ്പർ വെൻ ഇറ്റ് കംസ് ടു ദ പ്രിപ്പറേഷൻ ടൈം, കാരണം വാം-അപ്പ് സെഷൻ കഴിഞ്ഞാൽ ഉടനെ നമുക്കുള്ളത് റോൾ പ്ലേ കാർഡ് പ്രസൻറ്റേഷൻ ആയിരിക്കും, wherein you will be making the presentation of 2 role play cards. അപ്പോൾ റോൾ പ്ലേ കാർഡ് നമ്മുടെ കയ്യിൽ കിട്ടിക്കഴിഞ്ഞാൽ ഉടനെ തന്നെ certain things which I want you to keep in mind. The first thing is ensuring comprehension of the task and your listener. മോസ്റ്റ് ഇമ്പോർട്ടൻറ്റ് തിങ് ഇതാണ്. നമ്മുടെ ലിസണർ, നമ്മൾ സംസാരിക്കാൻ പോകുന്ന ആളുണ്ടല്ലോ, who identify the person, is it a patient or a bystander? First of all നമ്മൾ അത് ഐഡൻറ്റിഫൈ ചെയ്യേണ്ടതായിട്ടുണ്ട്. പേഷ്യൻ്റ് ആണോ അതോ ഒരു ബൈസ്റ്റാൻഡർ ആണോ എന്നുള്ളത് ഐഡൻറ്റിഫൈ ചെയ്യുക. ആൻഡ് അവരുടെ ഇമോഷണൽ സ്റ്റേറ്റ് മനസ്സിലാക്കിയിട്ടുള്ള ഫ്രേസസ് പ്ലാൻ ചെയ്യുക. ഓക്കെ, അതിനനുസരിച്ചുള്ള ഫ്രേസസ് വേണം നമ്മൾ യൂസ് ചെയ്യാൻ വേണ്ടിയിട്ട്. അതാണ് കോംപ്രിഹെൻഷൻ ഓഫ് ദ ടാസ്കിൽ എനിക്ക് പറയാനുള്ളത്. മോസ്റ്റ് ഇമ്പോർട്ടൻറ്റ് തിങ്, ആ ടാസ്ക് എന്താണ് ആസ് എ ഹോൾ, ലൈക്ക് സിംപ്ലി റീഡിങ് ദ പോയിന്റ്സ് മാത്രമല്ല, ആ ഒരു പെർട്ടിക്കുലർ ടാസ്ക് എന്താണെന്നുള്ളത് ക്ലിയർ കട്ട് ഐഡിയ എടുക്കുക. ഇനി അതിനുശേഷം so as to maintain a good rapport with the person to whom we are going to speak with, make sure who is your listener, who is your target audience, അത് മനസ്സിലാക്കുക. is it a patient or a bystander, അതിനനുസരിച്ചുള്ള ആപ്റ്റ് ആയിട്ടുള്ള സിറ്റുവേഷൻ ഉള്ള ഫ്രേസസ് എന്ത് ചെയ്യുക, യൂസ് ചെയ്യാൻ ശ്രമിക്കുക. So this is again something very important. So once you read the role play card, make sure you're getting a complete idea as to what is the situation given to you, because you'll be given a scenario. So when you read the scenario, make sure you're getting a complete picture of what is going to happen. So you need to check who is your target audience. Is it a patient or a bystander? Then you need to look for the emotional situation of the person. What kind of a phrase should I use there? If the patient is appearing to be concerned, then you need to use certain sympathy phrase and reassurance. If they are like a partial reluctance they are giving you, then what you need to do is you need to add much more empathetic phrases at the same time. Okay, that is something very important. And one more suggestion from my side is always mark down the keywords. I hope you know what are the keywords. The first word with which a task start. For example, if in case this is your role play, this is the first keyword. Okay, after the just after the bullet point, the word which is given there is a keyword. So we have to make sure what kind of a word is it. So is it an information gathering word or a providing word? As you people know, we have information gathering words as well as providing words at the same time. So what are the information gathering words that you've come across? Most probably you have come across the word find out. Other than that, there are certain other words also. For example, ask, okay, inquire, collect, and explore, establish. So these are certain information gathering words. So this will give an idea that you're going to put forward a question. Okay, so make sure that you're asking question at that point. Once you're going through the task with the explanation, make sure when a word comes which is an information gathering word, at that point you're supposed to ask a question. So please make sure you're marking down the keywords given to you. Otherwise, you'll be simply going with the explanation. Okay, so you make sure that you're just having a good idea as to what are the keywords given there. Once again, to give you an idea about the information gathering keywords, the most important one is find out, then we have check, ask, then inquire, collect, establish, explore. These are certain information gathering words. And coming to the next word is information providing keywords. We do have certain information providing words at the same time. For example, what are they? Explain, okay, outline, describe, suggest, advise, reassure. So these are certain words which give an idea that we are supposed to give information to the patient. So make sure that you are having clear idea about these keywords also, because to mention this role play card given to you is actually a guide. Okay, this particular role play card leads you as to where should I give an explanation, where should I ask a question. This role play card is a complete guide. So make sure you're having an idea about these keywords at the same time. Okay, so that is something very important when it comes to utilizing your 3 minutes preparation time. And as I mentioned, once you get an idea about your target audience, make a note of certain phrases. For example, if in case you write down a simple S, it is suggestive of sympathy phrase. Okay, if you write down an E, it is suggestive of an empathy phrase. So make sure that you're doing so. And R is suggestive of reassurance. So if you do so, when you come, when you reach a particular point, you'll get an idea that I have to provide a reassurance there. For example, once you finish with this task, if you add a reassurance there, then you will be getting a clear idea that once you done with the explanation of this particular point, you have to add a reassurance there. So this is how you can utilize the preparation time given. Reading, this must happen simultaneously. Like once you're reading, at the same time just make sure that you are writing down and jotting down certain important things over there. So please make a use of this 3 minutes preparation time given to you. Okay, and coming forward with this, moving forward, I would like to just brief in about the expected scenarios. So we have been discussing a lot of case recently. I mean, we used to discuss a lot of case. The first one is an unknown case, which you people are pretty much familiar with. So unknown case can fall under two different categories. It can either be an emergency situation wherein a patient coming to you might not be feeling well. They will be having, kind of an physical difficulty, so which is visible to you. When a person is having some difficulty which is visible to you, you can consider that particular situation or a scenario as an emergency situation. And the second one is a non-emergency situation, when a person coming to you is having, the person is like there for an inquiry, or they are not having any physical difficulties as such, then we can consider that particular situation as an unknown case. So make sure that you are having complete idea about an unknown case, whatever the scenario given to you. Okay, when you consider an unknown case, when you read the scenario, you have to make sure whether I should start this case as an emergency or a non-emergency. And how come you will get an idea? When you read the card, make sure that how the patient is feeling at present. If they're having a physical difficulty, for example, they have sustained a cut or an injury, okay, or they're having bleeding, or they're having a swollen hand, or an area. So you can, these difficulty you can see. So at that particular situation, you can consider that situation or that scenario as an emergency situation. If in case not, then we'll be just starting it as a non-emergency case. For example, good morning, please make yourself comfortable, I'm so and so working here. This is how you can start a non-emergency case. Alright, and I've done a lot of cases based on this emergency, non-emergency, every kind of situations. If you have any confusion with how to start a scenario, please do check those live sessions. Okay. And coming to the second one is, it is a known case. Known case again can fall under two different situations. It can either be a conversation with the patient or a conversation with the bystander. Okay, it's not like all the time we'll be speaking with the patient only. We may be conversing with the bystander at the same time. So we have to make sure what type of a situation is given to you, and then only we'll be starting with the presentation, the beginning, the introduction, because introduction is something which is not given in the card, we're giving from our side. So we have to make sure that everything is in a proper format. Okay, so when it comes to a known case, there are certain identification, certain words which will give a clear-cut idea as to this is a known case at the same time. For example, it is confirm your visit. So if in case it is given, confirm your visit. then it is definitely a known case. Why? Because we are confirming the reason for our visit. This your is actually an indication to the nurse. Wherever you see a word you and your, so this is actually an indication to the nurse, not to the patient. So when it is given confirm the reason for your visit, it will be a known case. Alright, and we'll be actually the thing given there will be a purpose of visit. So that is something which helps us to identify the type of case here. Alright, I hope you got an idea. And also you have to make sure, as I mentioned, whether you're going to speak with the patient or with the bystander. That is something again very important that I want you people to keep in mind. And proceeding with the next task, it is an unknown to known situation. So when it is an unknown to known situation, it will be given that the person is coming to you again. It is a second visit. I mean, they're coming to you again, a revisit kind of a scenario. So if in case it is given, confirm reason for patient visit. Okay, patient's visit. So this particular situation falls into the category of an unknown to known case. So we are confirming why the patient is here. So we have to make a confirmation on that. So we can simply ask the person, how can I help you today? The person will be telling you, I came here for a clinical assessment. Alright, so could you please state your name and age for my confirmation? Oh yes, I've got your file, it is here and I can see that you are here to have your preclinical assessment, am I right? This is how we'll be starting that particular situation. So if in case in your card it is given, we have to confirm the reason for the patient's visit, so it will be an unknown to known case. Otherwise, if in case it is given that we have to confirm the reason for our visit, it will be a known case. Okay, this is something which gives an idea. For example, I always tell you people, ask you people to decide the type of case based on three things. That is the setting, scenario and the first task. ഈ മൂന്ന് കാര്യങ്ങളാണ് type of case നമുക്ക് മനസ്സിലാക്കാൻ വേണ്ടിയിട്ട് help ചെയ്യുന്നത്. Not just a setting, നമ്മൾ മൂന്ന് കാര്യങ്ങൾ ശ്രദ്ധിക്കണം. The setting, scenario and the first task. ഈ മൂന്ന് കാര്യങ്ങളും കൂടി നോക്കുമ്പോൾ നമുക്ക് കേസിന് ഒരു ഐഡിയ കിട്ടും. What type of a case it is. അപ്പോൾ നമ്മുടെ first task, confirm reason for your visit ആണെന്നുണ്ടെങ്കിൽ it is a clear idea that it is a known case. Even if in case our first task is confirm reason for patient visit, it gives an idea that it is an unknown to known case. Then we have without introduction scenarios as well. So without introduction, you people know when it is mentioned that you have just examined the patient, you have completed the assessment of the patient. Always go for the past tense, completed, examined, checked. So you have to look for these words, something which has already been done. Okay, that is how it becomes a without introduction case. So we are going to discuss about the rest of the thing after examination. We are going to give a diagnosis or we are going to explain the rest of the thing once the examination is done. So henceforth we don't have to give our introduction again. കാരണം already നമ്മൾ അവരെ examine ചെയ്തു കഴിഞ്ഞു. So we don't have to give our introduction again. So we'll be starting this particular situation in the middle of the consultation. അങ്ങനെയായിരിക്കും ആ സിറ്റുവേഷൻ പോവുക. Then we have the home visit also. And without introduction case again falls under different categories. നമുക്ക് conversation with the patient വരാം, conversation with the bystander വരാം, conversation with the bystander when the patient is not present വരാം. ഈ മൂന്ന് സിറ്റുവേഷൻസ് ആണ് നമുക്ക് without introduction കേസിൽ എക്സ്പെക്ട് ചെയ്യാവുന്നത്. So make sure you are having a clear cut idea as to how to start this without introduction case too. Coming to the last scenario of OET speaking, it is home visit. So home visit is something which we definitely can expect. One set will be definitely a home visit. So when you get a home visit, make sure that you are getting a knowledge about what kind of a visit is it. So is it a first time visit or a regular routine visit? You have to check this particular thing. Okay, and once you get an idea, please make a note of the introduction points that you have to say, so that you won't be having any confusion once the interlocutor asks you to start with the conversation. അപ്പോൾ ഒരു ഡിഫിക്കൽട്ടീസും ഇല്ലാതെ നമുക്ക് സ്റ്റാർട്ട് ചെയ്യണമെന്നുണ്ടെങ്കിൽ എന്ത് ചെയ്യാം, ജസ്റ്റ് ആ ഇൻട്രൊഡക്ഷൻ ഒന്ന് ജോട്ട് ചെയ്ത് വെക്കുകയാണെന്നുണ്ടെങ്കിൽ ഇറ്റ് വിൽ ബി ബെറ്റർ, because it is all about the first impression. So make sure you're doing so. Alright, so I hope you got an idea regarding the expected scenarios of OET speaking. What are the expected scenarios? So these are the scenarios which you can expect for the examination. An unknown situation, once again to recap, unknown situation, it can either be an emergency or a non-emergency. And when will we take it as an emergency situation? If in case the patient whom you're going to talk with is not feeling fine, they're having some difficulty, then we'll take that particular situation as an emergency case. Okay, some physical difficulty which is visible to you. And the second thing is non-emergency, when the person is coming to you to seek information on something, they're worried about it, so we'll be taking that particular situation as a non-emergency situation. Coming to known case, known case can fall under two different categories: conversation with the patient as well as conversation with the bystander too. And the third one is unknown to known, when the person is coming to you and we need to make a confirmation on why they are here, and then when we on that particular situation, when we have to make a confirmation on why the patient is here, we'll be considering such situation as an unknown to known case. Then we have this without introduction case, which we'll be beginning in the middle of the consultation, not from the beginning. So greeting and all is not required. We'll be just starting the case after assessment. So it is a discussion after assessment. And finally, coming to the situation of a home visit, when we'll be paying a visit to the patient's home. And this home visit can either have a situation of a merged case also. So it is a home visit and you've already completed the assessment of the patient. That particular scenario we can expect in a home visit as well. A merged situation, home visit plus without introduction. So all these things are, all these are the scenarios which you can expect for the OET speaking subtest. And as I mentioned, you don't have to worry. Every point, whatever you need to explain will be given in the card. And organization is something very important. So 3 minutes utilization we discussed. Please keep this thing in mind. Okay, and when the scenario is given to you, when you're looking for your target audience, the target audience can even vary. So the first thing would be, if in case you're speaking with a very concerned patient, then we have to use sympathetic approach. Okay, and also you have to reassure the patient. What if your patient is not having any concern? They're not at all expressing any concern. Then what are we supposed to do? Then you can, appreciate the inquiries the person is making. So patient concerned ആണെന്നുണ്ടെങ്കിൽ sympathetic approach ആയിരിക്കണം, reassurance കൊടുക്കുന്നു. When the person is not having any concern, ഒരു concernും express ചെയ്യുന്നില്ല എന്നുണ്ടെങ്കിൽ അവിടെ നമുക്ക് എന്ത് ചെയ്യാം? Appreciations കൊടുക്കാം. Well, I really appreciate your inquiry. That was a reasonable question from your side. Yeah, I really appreciate you willing to seek more information on this. എന്നൊക്കെ പറഞ്ഞിട്ട് എന്ത് ചെയ്യാം? Appreciations കൊടുക്കാം. On the other hand, when the patient is a reluctant person, we can expect a reluctant patient too. When the patient is reluctant, we have to, make sure we are compliant with whatever they are saying. We are actually following. നമുക്ക് properly മനസ്സിലാവുന്നുണ്ട്, നമുക്ക് relate ചെയ്യാൻ പറ്റുന്നുണ്ടെന്ന് അറിയിക്കാൻ വേണ്ടിയിട്ട് we have to use empathetic approach. And the final situation is a mother and child case. You can expect a mother and child situation, so which requires utmost care, handling. So make sure you're using adequate phrases. Either sympathy or empathetic phrases would be definitely suitable. Okay. അപ്പോൾ ഈ 4 situationsum clear cut idea ഉണ്ടായിരിക്കണം. When the patient is overly concerned, not too concerned. If the patient is, reluctant, not, having a proper rapport with you. And the fourth one is that of when you're having a mother and child conversation, speaking with the parent. That is again something important. I believe you got a clear picture. Moving further with the, how to make the presentation. So to be very precise, how to make an impactful presentation. That is something very important. So arrange your content logically. Logically in the sense that you should have a proper introduction, which is not given in the card, which is given from your side. And then moving further with the content part, the content should be very clear, and also make sure that you're not rushing. Speed ilonnu paranju povanda, maintain a normal pace always. You have to make sure about it. And finally, giving a conclusion according to the situation. എന്താണോ സിറ്റുവേഷൻ, ആ സിറ്റുവേഷൻ ആപ്റ്റ് ആയിട്ടുള്ള ഒരു കൺക്ലൂഷൻ കൊടുക്കുന്നു. ദിസ് ഇസ് എ ലോജിക്കൽ ഓർഡർ ഓഫ് your content organization. So starting with a proper introduction according to the scenario given, then organizing the content, not giving everything at a stretch. എല്ലാം ഒന്നിച്ചങ്ങ് പറയാനുള്ളതല്ല, step by step properly clearly പറഞ്ഞു കൊടുക്കുന്നു. And then conclusion. Coming to the conclusion as per the situation given to you. So if in case the person is there for a consultation, make sure you're mentioning about the consultation towards the end. If the person is there for seeking information from your side, make sure you're giving a leaflet at the time of your, at the end of the discussion. Okay, if the patient is an inpatient, make sure that you're providing, adequate assistance. You can even say, you can press the call bell, I'll be here in the nurse station, and I'll come here and help you with the same. So according to the situation, you have to end. Simply saying, I believe I addressed your concerns is not the right thing. Okay, conclude according to the situation given to you. Consultation means you'll be mentioning about the consultation and making the arrangement for the same. Seeking information, you can provide a leaflet. And then if the patient is an inpatient there, we can tell the person that anytime we'll be here to help. So press the call button. This is something, a proper conclusion to the given situation that is, in the role play card. And also make sure there is a proper involvement of the interlocutor to the conversation as well. It's not like you speaking all the time. 5 minutes നമുക്ക് given ആണ്. Make sure this 5 minutes you are using it properly. അവരെയും കൂടെ നമ്മുടെ കോൺവെർസേഷനിലേക്ക് പ്രോപ്പർലി ഇൻക്ലൂഡ് ചെയ്യാൻ വേണ്ടിയിട്ട് ശ്രദ്ധിക്കുക. ഓക്കെ, ദ ടു തിങ്സ് വിച്ച് വി യൂഷ്വലി ഡു ഇസ് ആസ്കിങ് ക്വസ്റ്റ്യൻസ് ആൻഡ് ഓൾസോ we used to ask questions to the interlocutor so as to include them into the task. Other than that, seeking clarification, making sure that whatever we are saying is clear to the patient. Okay, clarification, seeking clarification is something again very important. Make sure you're doing the same. Okay, two things to involve the interlocutor into the conversation. The first thing is asking question, second thing seeking clarification, and make sure you're not repeating the question phrases also. Do you have any concern? Do you have any other concern? Do you have any further concern? So please avoid the word concern. You can use some other phrases. Is there anything concerning you, or is there anything bothering you at present? Would you like to ask me any question on this? Do you need any further clarification from my side? Is there anything you would like to express here? So these are certain phrases you can use. Other than that, seeking clarification also is very important. You can simply say, I believe you're getting my points, and make sure you're using the name also. Otherwise, it somehow feels to be a bit of rude. Am I clear? Sounds rude. Other than that, you can just say, am I clear? If in case the patient is Thomas, am I clear to you, Thomas? Would be something, much more better. Sounds good. So make sure that you're using the name given to you. And the most important thing in terms of the, as we know about the speaking criteria, speak with clarity. Clarity here means with proper pronunciation. Okay, make sure you're not making it in a rush. Okay, so it should be in a proper, clarity. Whatever you're saying should have proper clarity of words. Second thing, coming to fluency, don't rush. Make sure you're always maintaining a, a normal pace, not too fast, not too slow. And focusing on pronunciation. Pronunciation again means the clarity of words. Make sure if you're rushing means, the last word will be getting break. So you have to speak in a proper manner. And making sure there is proper intonation of voice. Intonation, you people know, modulation of the sound. Because something you're reading from there, right? Given in the role play card, you're reading from there. So make sure there is proper intonation of your voice at the same time, so that it won't feel like you're reading from somewhere. And coming to the time management, it is very important. 5 minutes given, you have to utilize that time. Okay, so it might differ. Like always, the role play card won't be pretty lengthy. It might be short, it might be long at the same time. So we have to use the 5 minutes given to you. So as a tip for the time management, you may go with summarizing of the topic. So mostly people used to go for this brief summary. We do have another format of elaborate summary at the same time. So if your task is long, very long, you can go with this brief summary. You may use brief summary. And what does this brief summary means? A concise review of highlighting the main points. For example, you can just say, I believe I have addressed all your concerns as of now. Let me just recap the information what we discussed right now. So I told you about the causes of this condition. Later on, I discussed about the management. I believe everything is in your mind, just highlighting the keywords. If in case you feel like your task is pretty lengthy, and if in case your task is short, you feel like the task is very short, then you can go with an elaborate summary. That is a detailed explanation, that completely covers the whole topic. For example, ഒന്നുകൂടി നമ്മൾ പറഞ്ഞ കാര്യങ്ങൾ ആദ്യം തൊട്ടേ ഒന്നുകൂടി നമ്മൾ എന്ത് ചെയ്യുന്നു, മെൻഷൻ ചെയ്യുന്നു. So you came here with the complaints of this thing. I have discussed what is this condition. So collecting information from your side on the onset when the problem started and the treatment that you've tried, the previous occurrence and the family history, I came to a conclusion. I suspect that it might be due to this thing. Later on, I explained what this condition is. എന്ന് പറഞ്ഞിട്ട് നിങ്ങൾ പറഞ്ഞ ഓരോ പോയിന്റ്സ് നിങ്ങൾക്ക് അവിടെ എന്ത് ചെയ്യാം, ഒന്ന് സമ്മറൈസ് ചെയ്ത് കൊടുക്കാം. Okay, why? Because we have to use the time given. Okay, so I believe you got an idea. ഈ ഒരു 5 മിനിറ്റ് കോൺവെർസേഷനിൽ ഏറ്റവും കൂടുതൽ ശ്രദ്ധിക്കേണ്ടത് ഇതാണ്. ആൻഡ് ഓൾസോ ഈ ഒരു പ്രസന്റേഷൻ ടൈമിൽ മേക്ക് ഷുവർ ദാറ്റ് യൂസിങ് അഡിക്വേറ്റ് ഫ്രേസസ്, നോട്ട് ജസ്റ്റ് ഫോക്കസിങ് ഓൺ ദ ഗിവൻ കോണ്ടന്റ് മാത്രം കംപ്ലീറ്റ്ലി പറഞ്ഞു പോകുക എന്നുള്ളതല്ല. ഇൻവോൾവ്മെന്റ് വിത്ത് ദ പേഷ്യന്റ് with the person is very important. So make sure you using phrases according to the situation given to you. So I believe you got a clear picture on what we have discussed right now. So we were having a final lab revision on the OET speaking subtest. So we started the discussion with how to approach the warm-up session. I just made an idea on, gave an idea on what are the things that you can do on the preparation time, 3 minutes given to you. Later on, we have discussed about the expected scenarios which you can, which you might get for the examination. and then we discussed on how to give an impactful presentation for the 5 minutes time. Okay, ഈ പറഞ്ഞ കാര്യങ്ങളൊക്കെ മനസ്സിലുണ്ടാവുമെന്ന് ഞാൻ പ്രതീക്ഷിക്കുന്നു. Wishing you all the very best for your coming examination. Yes, Tindu, I got an idea. And also, hi, Balvinder Kaur. Good morning. And yes, so wishing you all again, a very all the very best for your examination. I believe you got a clear picture. Make sure that you're speaking very confidently. You don't have to worry about anything because you have language with you and the content given. So make sure you're speaking confidently. And also, whatever things about the organization that I've mentioned, keep these things in mind. Definitely you'll be getting a 400 above score. So wishing you all again a very best. Do let me know about your exam and also the score after getting your result. I'll be pretty much happy to hear the same. Once again, thank you everyone for joining this live session. Thank you. Have a good day.